Care Funding Calculator is an Excel-based needs assessment and pricing tool that's been developed by Improvement and Efficiency South East for use by adult social care departments. Local authorities are using the Care Funding Calculator for a number of reasons. Firstly, they've got increasing demographic pressures on their budgets. People are living longer, people with higher support needs are coming through from children's services, and there's general pressures on the budget over and above the budget cuts that local authorities are facing. So they're using the Care Funding Calculator as a way of trying to manage the market in residential care and also in supported living, so they can try and understand what it is they're buying, how much they're paying for it, and it's very clearly kind of understood by all parties about what these support packages are for and how much they are valued at. Outcomes for service users. I think that there's some big benefits from the CFC, kind of leaving the money side of things aside. People's support needs are going to be very clearly charted, and it's going to be, obviously we're charting them in terms of time, but it's very clear what people's support needs are. We're trying to, it's in addition to the support plan or the assessment that will say somebody needs support with personal care, full stop. We are then sort of exploring, well, how long is that support needed for and in what particular tasks. Once we've captured that information, it then becomes much easier in the future if people's support needs increase, or maybe if they decrease because they increase their independent living skills. We can then go back and look, but we have a snapshot of people's support needs, and I think that's a real benefit for service users. West Midlands specifically, we've been doing a number of projects. Firstly, we've been doing lots of training with the Care Funding Calculator, so we've been training social workers, care managers, commissioning staff, and also in one authority we've done some sessions with providers as well. So we've been getting the skills up in using the Care Funding Calculator so that everybody across the region is starting on a level playing field. The second thing we've been doing is some sort of discrete projects with individual authorities, giving them some assistance with negotiations on their high cost placements, developing some of their skills around negotiation and some of the more advanced skills involved with using the CFC that you would only maybe be training one or two staff with as opposed to your entire staffing team.